Honorable Ministers and members of the Regional Committee, it is a pleasure for me to stand before you and present myself as a candidate for the WHO Regional Director for Africa position. Honorable Ministers, our region still faces several critical challenges, impeding progress towards universal health coverage and the Sustainable Development Goals. With 6 years until 2030 deadline, many countries in our region are off track to achieve health-related SDGs, especially on maternal and infant mortality, malnutrition, and vaccination coverage, to mention a few. The presence of multiple player actors in the health sector is also causing duplication of efforts and the competition for resources. WHO Afro is grappling with financial constraints due to declining budgets. Health sector financing, particularly domestic financing, that is below the set target for Abuja Declaration. There's also a significant shortage of healthcare workers across member states. Emerging and re-emerging diseases pose ongoing threats as the current ongoing mpox outbreak. Climate change is impacting health outcome. Antimicrobial resistance and non-communicable diseases are increasing concern. Fragmented health systems remain unaddressed, highlighting the need for greater integration as noted by my predecessors. Honorable Ministers, going forward, WHO Afro needs to renew and reposition itself to align with the current needs and challenges by doing the following. 1, be more responsive and supportive to the needs of the member states. Secondly, being at the center of mainstreaming Africa's health agenda at the global stage. And thirdly, to engage more in health diplomacy with the political and the policy makers in the continent, the people whose decision impacts budgets and health services delivery and health outcomes, as well as the major funding agencies. In this context, WHO Afro needs a transformational leader with a vision and track record to drive change, and not a transactional leader. We need strategic leadership and management at the helm of WHO. Honorable Ministers, my transformative agenda will address the following. Healthcare financing, looking at increased domestic funding, engagement of public-private partnership, healthcare workforce development and deployment, including community health workers, and also driving innovation and technology in the health sector. Honorable Ministers, I'm fit for purpose for this role. With my background as a technocrat, former Deputy Minister for Health, a former Minister for Communication and ICT, and a parliamentarian, I possess technical, policy, and people-centered leadership approach for driving health and well-being agenda. I have years of national and international multicultural experiences, working at technical level, providing expertise, guidance, and strengthening health systems in several countries, including Tanzania, South Africa, Mozambique, Angola, and Rwanda. I also know how it feels to be a minister for health with a mandate to meet the people's expectations. I've worn those shoes before. I know the pressures ministers face and the support they need and expect from the WHO and other stakeholders. In my service as a Deputy Minister for Health, I gained solid experience in implementing policies aimed at reducing health disparities, promoting health, gender equity, and advancing universal health coverage. As a Minister for Communication and ICT, another area that I'm very passionate about, I led a multidisciplinary team to champion digital transformation, increase internet coverage, and foster the use of technology to improve health outcomes in Tanzania. My political background and work as an elected member of parliament has equipped me to deliver on the political engagement and the healthy diplomacies needed to steer Africa towards the healthier future. I've been a member of Pan-African Parliament, chair of Parliamentary Committee on Health, the vice chair of Interparliamentary Union Advisory Group on Health. These experiences and in these platforms and so many other platforms demonstrate the power of health political mainstreaming in 21st century. Honorable Ministers, my vision is to see the African region where every individual thrives with optimal health and well-being, supported with accessible, equitable, and sustainable health systems contributing to a healthier Africa. My mission is to foster the final push for attainment of the health-related SDGs as mandated by the strategic priorities of the 14th WHO General Programme of Work and the African Union's Health Strategy of 2016-2030. If elected, I will focus on 4 pillars of priority investment. 1, enabling right to health. 2, enabling readiness for the next pandemic. 3, enabling health political mainstreaming. And lastly, enabling responsive WHO Africa region. I'll start with the first priority. Honorable Ministers, I believe that health is a fundamental human right. However, the Universal Health Coverage Service Coverage Index is below 50 for majority of countries in the region. Moreover, Sub-Saharan Africa contributes to 70% of the global maternal mortality, 56% of global under-5 deaths, and 30% of stunting. Additionally, there's a sharp rise of non-communicable diseases, which contributes to over 30% of all mortalities in our region, including a rising problem of mental health. The solutions to these challenges require both political acumen and the technical competences. We know the interventions that work. We know how to implement these interventions. What we need now is the political will and the resources to implement these programs. If elected, I plan to intensify health diplomacy and engagement with policy and political leaders, and also promote innovative financing mechanisms. My second priority, Honorable Minister, is on enabling readiness for the next pandemic. Recent global health emergencies, including COVID-19, have underscored the need for robust pandemic preparedness and response mechanisms. Many lives were lost due to delays in detecting and also accessing essential vaccines and other health commodities. Again, we are seeing internet has led to a new epidemic of false information. The explosion of infodemic or misinformation that are damaging confidence in evidence-informed strategies and undermining the uptake of novel vaccines and medicines. Honorable Ministers, we need to better prepare for the future public health emergencies. In the current situation, it's difficult to secure and prepare for pandemic given that Africa region imports over 90% of medicines, vaccines, medical devices, and active pharmaceutical ingredients. And we've seen this in the case of a recent Mpox outbreak. We are in need of vaccines, but the number of doses that were available to the continent do not match what we really need. If elected, I will prioritize Africa's investment in local manufacturing capacity of priority health products, including vaccines, medicines, diagnostics, and other countermeasures. Foster impactful collaboration with stakeholders on the issue of access to essential commodities and technology transfer. Develop systems for managing infodemics. Work with the Africa CDC and other partners to optimize Africa pandemic response capacities, including strengthening in-country capacities to prevent, detect, and respond to emerging infectious diseases. Strengthening surveillance and antimicrobial resistance, and also promoting antimicrobial stewardship. Strengthening of the Africa Public Health Emergency Fund, and the promotion of One health approach. My third priority will be enabling health political mainstreaming. Honorable Ministers, amid meager and diminishing resources, there are concerns of duplication of efforts and competition among various players in the health sectors. In order to bring coherence, I advocate for 5 C's. The first C is clarity of mandate. The second C, better communication among agencies. A third C, better coordination. A fourth C, foster collaboration. And lastly, complementarity, while leveraging on expertise and coverage. If elected, I'll foster stakeholders' engagement and alignment, as well as support harmonization of roles and evolution of One Africa strategy and leadership on health. I believe in complementarity rather than competition. My fourth priority will be enabling responsive WHO Africa Regional Office. Honorable Ministers, currently, country support functions of WHO in Africa region is led by country offices and supported by multi-country assignment teams, MCATs, of technical expertise stationed in 11 national capitals in the region. Effectiveness of the MCATs is affected by staff paucity and the challenge of skill mix. I will strengthen institutional structure to respond to the current and emerging needs of member states, including transparency, efficiency, and accountability, placing Africa at the forefront of the global health agenda. There's a need for a strong and appropriately tuned regional offices closely engaged with the regional economic communities. As the WHO Director for Africa, I will therefore review the business model of WHO Afro Regional Office to enhance efficiency for optimal performance and impact, while assuring gender equality and the geographical equity, while recognizing that the importance of each member state. I plan to strengthen WHO country offices, prioritizing the needs and the voices of member states, ensuring that the strategies and the policies reflect the unique health challenges. No one glove fits all. By tailoring our approach, we want to provide more effective support to countries and achieve better health outcomes. My commitment. I'm convinced that the WHO exists to foster solutions for health and well-being for all. I therefore seek the mandate as the WHO Regional Director for Africa to foster solutions for Africa's health and well-being through optimizing available people, processes, technologies, research and development towards the attainment of 2030 health-related SDGs in Africa and beyond. I pledge to build on the foundation laid by the current and the previous directors and the WHO team to deepen ongoing transformation agenda of WHO in the African region with a focus on responsiveness to the needs of the member states and stakeholders. Investment in health, sustainable financing, health workforce, efficiency, equity, and strategic partnership. My call to action. Honorable Ministers, we stand at a very critical junction in the African journey towards achieving health and well-being for all. The decision that you are going to make today will shape the future of our health in our continent. The decision that you are going to make today is going to impact the millions of lives and livelihoods and determine our legacy for generations to come. Honorable Ministers, you have the opportunity to support a leader who understands the complexity of Africa's health challenges and possess the strategic insight and urgency to turn these challenges into opportunities for growth and development. Honorable Ministers, I stand before you to reaffirm my earlier commitment that I believe we can work together. We will result in strengthening Africa's health system through sustainable health financing, strengthen health workforce, including community health workers, data integration and harmonization, health technologies,